Yeah, hi Shama ma'am. Can we start?
Yes, sure, sure. So, today, good evening, everyone, and welcome you all to the third day of this webinar series. And it's an enriching talk by Dr. Jayesh Varade, a very experienced biochemist. So, welcome, Dr. Jayesh, and I hope everything is ready on your side.
Yes, yes, yes.
Okay,
Can
so we
start.
commence, yeah, so we commence with the series today without further ado. Thank you, sir. The dais is all yours.
Okay, thank you. So we will start. So before starting the today's session, let me tell you, you can just check the chat box once because there are some links which are post for because many of you are getting the questions like when they will get the certificate, whether they have to do the pre-assessment on daily basis, and how they will get the transcript. So all those FAQs have been answered in the link which is shared in the chat box. So you can click the link and you can go through those answers for any of your queries. Also, these answers and these FAQs are posted on Mindray website also. So you can go through all those questions and you can find out your answers. So to begin with today's session, which is the third part of this series, here today we are going to see pre-examination processes, and the next part here we are going to see today is the sample acceptance and rejection. So first of all, to begin with pre-examination processes, as during the first session itself, I have mentioned in our definitions, pre-examination processes are basically all those activities which are carried before actual processing of the sample. So it includes your test requisition or a request which is raised by a clinician or by the patient himself. Then the sample collection part. Sample collection part includes number of tests, right from the identification of the patient, preparation of the patient, instructions to be given for the patient for appropriate preparations, then how to fill the requisition forms, how to collect the samples, what is the appropriate procedure which is required to prepare the parts of your body before collecting the samples. Mainly, specifically, if we talk about like samples are collected from the cubital fossa or from median cubital vein. So how to prepare those parts. So these instructions and all these activities are included as a part of pre-examination processes. So when we consider a medical laboratory, pre-examination is the biggest contributor to the laboratory errors. Hence, this phase should not should get adequate focus and monitoring to ensure accurate results and generation of the result generation by the laboratory. So as most of you will be aware that there are multiple papers, research papers which have been published, and they claim that around 20 to 70% of the errors in your laboratory are due to pre-examination processes. So we consider pre-examination as the biggest contributor of the laboratory errors. So we should focus these areas more appropriately, and most of the time, as we have seen, it is quite neglected areas because these areas are not properly supervised. Most of the time these areas are away from your central laboratory, so it is not possible to have a continuous supervision or continuous monitoring. So these areas contribute to the biggest, or these are the biggest contributor of the laboratory errors. So to begin with, first step is the patient preparation. So patient preparation as per the prescription or requirement is the first important step in the sample collection. So what is mean by patient prescription preparation? So many a times not all the tests are required or can be performed at any time of the day. So for that purpose, you may require a specific preparation of the patient. You need to see what is the status of the patient. Maybe some tests require absolute fasting status, so you have to see whether the patient is in the state of fasting or not. If any specific timing is there for sample collection, if patient is himself is collecting the sample, like we know urine samples, sputum samples, stool samples are collected by the patient themselves. So what are the precautions, what are the preparations, what are the diet foods they should avoid, what are the precautions they should take while collecting these specimens and samples, those are all included in your preparation of the patient. So considering the prescription means whatever test is requested. Considering the test request, appropriate patient preparation must be carried out because it it is basically one of the source of variations in your examination results. So if the patient is not in a state of the fasting, then your results may vary. As I mentioned, some tests that patient may be fasting require that there are specific timing of sample collections, like certain hormones. If you see the cortisol hormones, these hormones are collected mostly at morning 8 a.m. or evening 4 p.m. Testosterone hormones samples should be collected before 10 o'clock or around 6 o'clock to 8 o'clock in the morning. Then we have various protocols for collection of other samples such as luteinizing hormone, follicular stimulating hormone. So all these hormones require a specific preparation of the patient. So all these preparations must be considered before actually collecting the patient sample. Now, actual sample collection or a primary sample collection procedure. So SOP for primary sample should be available to all the personnel at collection site, and they should be well trained to follow all the steps. So you should have appropriate standard operating procedure for collection of the specimens. So various specimens, as I have mentioned, we have blood collection, we have urine collection, we have stool collection. So you should have appropriate SOPs ready in your laboratory for the staff who is responsible for collection of the samples. Now, many times, not only your phlebotomist in your laboratory, but certain nursing staffs are also involved in collection of the samples. So they also must be aware of those protocols of sample collection. Many times paramedical staffs are also there. So sometimes samples are collected in the ambulance itself during emergency situations. So all those areas and those staff personnel must be trained, and they should have knowledge of standard operating procedure for sample collection. Now, in addition to that, many times we have seen many specimens are collected by the clinicians themselves. Which are these specimens? Biopsies obviously are collected by clinicians. Then there are cytologies. Pap smears are collected by clinicians. Many times radiologists are also involved in collection of the in fine needle aspiration cytology. So all those persons must be aware about the collection procedure. What are the precautions they should follow while collection? Immediately after collection, how the specimen should be preserved so that the integrity remains. So they should be aware about all the standard operating procedure. Specimen collection can be done at the patient bedside, in the laboratory, or in the field. As I have mentioned, specimen can be collected either in your laboratory collection area or maybe bedside, that is in the wards, ICUs, or in the field also. So we have seen many times certain camps are there in the field or in the communities. There also specimens can be collected. So whoever is involved even in the community for the sample collection activities, whoever is responsible, they should have appropriate knowledge of this standard operating procedure. Then devices. What are the sample collection devices we should use? So standard precautions should be followed during specimen collection. Now, what are the standard precautions? So you should use always gloves should be used, appropriate mask should be used so that you are getting protected from any type of microorganisms. Your patient gets protected from microorganisms. There should not be cross contamination from one patient to another patient. So we should always use gloves, mask while collection of the samples. You have two systems for sample collection. One is the closed system and one is the open system. So closed systems are basically in which evacuated collection devices. So we have tubes, vacuum tubes are there, or evacuated tubes are there, which are used for sample collection. They have a lot of advantages. They have it ensures the appropriate sample collection volumes. It also ensures appropriate and reliable collection methodologies and techniques rather than syringes and needles. So here, this good clinical laboratory practices from ICMR specifically insist on collection system which is closed should be preferred. They have a lot of advantages and it is generally preferred over syringe and needle. Specimens must be collected, labeled, handled and transported in a manner as recommended by the manufacturer of the devices or the kit or the test method. So once the sample is collected, you have to label it, The specimens must be handled in an appropriate way and should be transported in a manner so that the integrity of your analyte or the integrity of measurand remains standard, and there should not be any contamination, or your transportation activities, handling activities should not cause deterioration of your analyte. So whatever is recommendations which are given by the manufacturers of the devices or manufacturers of the reagents, or what is specific to the test method which you are using in your laboratory, those recommendations and those guidelines should be followed for the collection of the specimens, or labeling of the specimens, and handling and transportation of those specimens. Appropriate tubes, container in terms of volume with or without anticoagulant should be used. Now, you must collect appropriate volume. Now, what is in the appropriate volume? Appropriate volume means whatever volume is required for performing the test. You should not have excessive collection, and you should not have a deficient or insufficient collection also. So volume of the specimens, blood samples, urine samples must be sufficient, which is required for appropriate performance of the test examination, and with or without anticoagulant. So you may require to use anticoagulant, or you may not require. Now, apart from anticoagulant, we have preservatives. So what is the difference between preservatives and anticoagulant? So preservatives are the substances which preserves the integrity of your analyte, and anticoagulant are the substances or the chemicals which prevents the coagulation of the sample. So these are two different things. We have to consider that anticoagulants are basically the chemicals which prevent the coagulation or coagulation of your specimens, and preservatives are basically for the preserving the integrity of your analyte. So as and when required, as per the test request and as per the specimens, you should use appropriate specimen, appropriate anticoagulant, and appropriate preservatives. So like, for example, if I mention, if we are collecting a glucose sample in a fluoride tube, so fluoride here is a preservative, it is not an anticoagulant. So if you see the gray color tubes in your laboratory, it contains fluoride, sodium fluoride, as well as EDTA. So EDTA acts as an anticoagulant, and sodium fluoride acts as a preservative, so that the glucose concentration or glucose levels does not get decreased or does not get appropriately preserved in the tube. So you have to use appropriate tubes, appropriate volumes, appropriate preservatives, and anticoagulant whenever it is required. Specimen should be secured so that there is no leakages, spillage, or contamination. So there are two aspects why we don't want to allow to spillage or leakages of the specimen, because it can affect the integrity of the specimen. It can cause public hazard. So if you are carrying a specimen from one part to another or from one location to another, so you should prevent the leakages, because many times some specimens are infectious, so it should not cause any public health hazard also. Or if the specimen, if there is any leakages, it can also cause contamination of your specimens. So the specimens must be secured appropriately to avoid any type of leakages, spillages, and contaminations. Now, samples for clinical research and trials. In addition to the above mentioned general requirement related to the specimen collection, the following information or following protocols should be adhered. What are these protocols which you should adhere? Appropriate counseling should be done before specimen collection, and written consent has to be taken. Now, many tests require or mandate as per the guidelines in Indian scenario that there should be appropriate pre-counseling before collection of the samples, and also there should be appropriate post-counseling. So many tests such as certain type of infectious disease testing like HIV, you need to have appropriate pre-counseling, like what should be included in this pre-counseling, like what this test, what is the purpose of this test, what can be the result, what is the implication of the result, and the details or the other related information of those tests. So this should be informed to the patient appropriately during the counseling session, and written consent must be taken. Now, written consent must be taken whenever you are collecting a sample, whenever you are collecting any invasive sample, like for histopathology or cytopathology, then obviously you should have a written consent. Apart from that, if you are collecting any specimens for the purpose of any infectious disease testing or any type of genetic testing, there should be appropriate counseling and written consent must be obtained. Now, many a times we can feel that whether a routine phlebotomy activity, whenever we are collecting a simple blood sample of the patient, is it required to obtain a written consent from the patient? So, for that, the answer is no, because once the patient comes to your laboratory with a requisition form, and once you accept those requisition form, it becomes itself is a consent, which is an implied consent. But this is limited to the simple phlebotomy technique. You cannot go beyond a simple phlebotomy technique. That means the patient is willingly submitting you themselves for the collection activities, because they themselves have come to your laboratory with the requisition, they have done the appropriate billing, they have deposited the requisite fees. So that means they are willingly submitting themselves for the collection of the blood sample. So routine phlebotomy activities does not require any specific written consent. Attention.
ટ્રેનિંગ જે આપે છે ને રજીસ્ટ્રેશન ફ્રી છે ને 3000 લોકો જોઈન થયા છે.
Please, if anybody has keep their mic on, you can just unmute yourself. Attention should be paid to the patient sensibilities during the entire processes. So you must be sensitive to the patient feeling. Sometimes some activities or some information may upset or may cause any type of disturbances in the patient's mind. So you should consider all those scenarios while giving appropriate counseling or while taking a consent. So you should be sensible to take the patient consent, considering their sensitive issues and considering the certain type of social stigma which is associated with some diseases. All clinical samples, whether it is for diagnostic or clinical research, should be considered as infectious and handled accordingly. So not only you should consider that any HIV sample or any samples for hepatitis B or hepatitis C testing, or more recently we have seen in COVID, not only COVID samples or not only any specific samples, all samples as a blanket, whichever is your purpose in diagnostic or research laboratories, all samples irrespective of their status should be considered as infectious and must be handled as per the universal safety precaution. So all samples are infectious. There is no any classification which is infectious and which is non-infectious. Certain samples may be detected as positive, so you are knowing that they are infectious. Certain samples may not be detected, but there is a chance that they can be infectious. So treat all samples as infectious and handle them accordingly as per the universal safety precautions. Next part is the labeling of the samples and documentation. Specimen should be labeled with at least 2 unique identifiers. From where this 2 unique identifier comes? Basically, as per the International Patient Safety Guidelines, there should be at least 2 unique identifier for a patient, which includes unique identification number, name, age, maybe their address, sex, or other details, their phone number, their email ID, anything you can use, but there should be 2 unique identifiers. And these 2 unique identifiers should be a positive identifier. What is meant by positive identifier? The patient themselves should identify with those identifiers. Like the patient themselves should tell their name. It should not be a yes or no question. Like some patient with a name, suppose XYZ is coming to your laboratory, and for confirming the identity, you should ask the name of the patient. Dear sir or dear madam, what is your name? You should not ask a leading question. Sir, is your name is XYZ? Or madam, is your name is XYZ? You should not ask this type of leading question. The name should be positively, the patient should positively identify themselves from their side. So these are called a unique positive identifier. So at least 2 unique identifiers should be allocated for all the specimens and for patient identifications. Specimen labeling using barcode is an option that may reduce error. So it doesn't guarantee, you have to see that patient labeling using a barcode doesn't guarantee in reducing the error, but it is an option that may reduce errors. But even with barcode, the two unique identifier must be used. So again, it is optional. It is not mandatory to have our printed barcodes, because as I mentioned, these are the minimal criteria which the laboratory should follow. Even the small laboratory should be able to follow those criteria. So it is not making anything mandatory. So it is again an option to have printed barcodes. Labels should include following information. What information should be put on the labels? Patient name, age, gender, their identification or patient ID, unique identifying number, test which is requested. So it may not be possible to label all the tests, but a group of tests can be clubbed or certain short forms can be used. Time and date of specimen collection, when the sample or when the specimen was collected and what was the date and what was the time, it should be mentioned on the label. Then apart from that, coming to the requisition form or test request form, which is also called as a TRF or test request. The requisition form should be completed by the doctor or healthcare worker requesting the test and sent along with the specimen patient to the laboratory. So a test request form must be completed appropriately by the doctor or healthcare worker. If required, you should give them appropriate guidelines how to complete this test requisition form, what are the details should be included in the test request form. Notice it is not mandatory that it should be completed only by a doctor. It can be completed or it can be filled by a health worker who is going to request the test. Now, many times we have seen it is not possible for doctors to fill all 1,000 or 2,000 test request forms. Or when we go for in communities for certain type of health checkups or camps, it is not possible for the clinician or the doctor to fill the test request form. So, on behalf of the doctor, the healthcare or health worker can complete the request form, and this requisition form must be sent along with the specimen or along with the patient to the laboratory. If you are sending the specimen, the request form must be accompanied by the specimen. If a patient himself is coming to your laboratory, then the test requisition form should be accompanied by the patient. In any case, it should not be a separate. Like first the specimen is going, then request form is going, or if the patient is going, then the request form is going. It should be sent along with the specimen or to the patient to the laboratory. Now, what are the important information or basic information which should be included in the request form? It should contain patient's identity, age, location, date and time of specimen collection, investigation which is requested, and source of sample. Source of sample means from where the sample is collected. Now we know, as all of we know, blood samples most of the time it is collected from median cubital vein. So you may not require to mention the size or source of the sample, but if you collect the culture samples for blood, then many times you collect the samples from both the arms. So maybe you have to write down right arm, left arm. Sometimes you are collecting histopathological specimens, you are collecting or you are retrieving many types of lymph nodes. So there are groups of lymph nodes, so right lymph node, left lymph node, vertical group of lymph node, horizontal group of lymph node. If you are collecting specimens or swabs from any abscesses, and if the patient has multiple abscesses on his body and you are collecting swabs from these multiple abscesses, then you have to specifically mention from which abscess or from which side the specimen or the swab is collected. So the source of sample must be included for our type of specific investigations. The TRF should be signed by the phlebotomist and the patient or doctor to indicate consent for the specimen collection. So it is a consent for the specimen collection. So many times we have seen there are many walk-in patients which are directly coming to your laboratory, or standalone laboratories will have such type of walk-in patient where the patient directly comes to the reception counter and asks for certain type of test. They may give certain oral requisition, or they may say orally that I want to test blood glucose, or I want to test certain liver function test. So they are not coming with any type of TRF. But in that case, you have to complete the TRF and you have to take the patient's signature. What it indicates? It indicates the consent for the specimen collection. So always have a requisition form which should be mentioning or which should have a signature of the patient and doctor, and it must also be signed by a phlebotomist. That means the person who is collecting the specimen. So it should be signed by a phlebotomist and also by the patient or doctor. The referring doctor should be encouraged to mention the provisional or working diagnosis and relevant clinical and treatment history in the space provided. So all the referring doctors or clinicians must be encouraged to mention a provisional diagnosis. At least you will have idea what they are thinking or what is going in their mind, what is their diagnosis or what probable diagnosis they are thinking. Or if nothing is there or if they are simply are not aware about any specific, then they should mention certain major symptoms or the treatment history, like they are giving some medicines or some medicines, the patient is under some medications or the patient is taking some special treatment. So those treatment histories must be provided. Or if the patient is on some type of body fluids, your fluid infusion is there. So those type of treatment history must be provided in the test request form. So here we are mentioning on annexure 3, which gives you a sample test request form. Again, you can take the screenshot of this. This is being given in the ICMR. This is being given by the ICMR only. So it includes name, age, sex, UID of the patient, OPD number, consultant in charge, like whoever the doctor or clinician, date and time of specimen collection, type of specimen, what is the specific test which is requested, provisional diagnosis if it is applicable, relevant clinical history including drug treatment, and then finally the signature and designation along with the date. So these details should be included in your test requisition form. Then after the collection, transportation of the specimens or transportation of the samples. When samples are collected in the field or outside the laboratory, it needs to be transported for analysis to a laboratory. So many times we have seen the samples are collected in some remote location, or in certain cases it is collected in the collection center, collection areas, or in communities. So once these samples are collected in the peripheral locations, which is away from the central laboratory, then it must be appropriately transported to laboratory for further analysis. Now the transportation conditions may vary for different specimens. In all the cases, the transportation of the sample should ensure sample integrity, stability for obtaining right result. So there, if required, specific precautions should be used, appropriate temperature conditions should be maintained, appropriate packaging should be maintained. Some specimens needs to be transported at room temperature. Some specimens needs to be transported at 2 to 8 degrees Celsius. Some specimen needs to be transported as a frozen specimen. Some specimen requires specific transport media for transportation. So all those precautions must be used or must be considered to have a integrity of the analyte which is to be of or which is of an interest. So considering the sample integrity and sample stability, whichever is required, appropriate transportation conditions and arrangement should be made for collection and transportation of the specimen. Transportation of the space samples should be managed as per the SOPs. Personnel handling the specimen samples should be trained for all transport procedures. So again, how to transport the sample, how to pack the samples, all those information must be given in your standard operating personnel, and those people or those staff, those personnel, those courier services which are involved in transportation of the samples, they should be trained. They should have knowledge of all those protocols and standard procedures, like how to pack the samples, how should be their triple layer packing. You have to mention a triple layer packing if you are transporting the specimens in general public. There should be a symbol of hazardous or biomedical waste or biomedical hazard symbol should be there. Appropriate address should be mentioned, like from where the sample is originating and from where you are transporting. All those details must be mentioned in your sample transport containers, and appropriate precautions must be taken while transporting those specimens. During transport of sample, following points should be taken care of. So what are the precautions which should be taken care of while transporting the specimen? You should consider the analyte stability, as we have already seen. Certain analytes are very light sensitive, such as bilirubin samples, vitamin B12 samples are light sensitive. Their stability decreases, or the stability of the analyte decreases if you are carrying those samples in during the sunlight. Then temperature requirement are there. You have to follow the specific temperature requirement, which is specific to each specific specimen and specific analyte. Preservation, if required, should be mentioned. As I have already mentioned, there are two different things. One is anticoagulant and preservatives. Preservatives are basically to maintain the integrity of the sample. So if there are any requirements, specific preservatives should be used. Photosensitivity, this issue just now I have mentioned that certain analytes are sensitive to light, so appropriate conditions should be maintained. They should be wrapped in aluminum foil, or this type of samples should be collected in amber colored bottles if required. Integrity and stability of the sample should be considered. Special packaging requirement in case of shipment. So please understand here that in case of shipment, so if you are transporting the specimen from one part to another part, or from one town to another town, then there are special packaging requirements. So those special packaging requirements should be followed. Timeliness, so there should be a specific timeline during which the sample should be transported. Not like that you are maintaining the temperature, so maybe you can wait for 1 hour, 2 hours, or you can just sit and you can send the samples on the next day. Even if you are maintaining the appropriate stability, appropriate timing should be maintained for transporting the samples. Timeliness should be considered, which will impact the stability of the analyte. Safety of the personnel handling the samples. Safety of the personnel, as I have already mentioned, the personnel who are handling or transporting the samples, they should appropriate personal protective equipment. They should consider, or they should use appropriate gloves and masks. Also, there should be a public safety also should be considered, as I have mentioned, so that the specimen should be tightly packed. There should not be any leakages. Biomedical or bio-waste hazard symbol should be affixed so that it is known, or it should not be mishandled by any unauthorized personnel. Tracking of the samples or tracking system for samples should be available. Tracking system is, when we make any shipment or any consignment, we get some tracking, like where your parcel or courier is available, then where it has gone, now where it is located, what is its location. So as far as possible, if there is a tracking system available, it should be practiced if it is possible or if it is feasible. Then next is the sample acceptance and rejection. So we are coming to the second part of this today's lecture, that is sample acceptance and rejections. All the specimens must be checked when received in the laboratory for fitness for testing. So whenever you are receiving the specimen in your laboratory, you should check regarding the fitness, regarding their acceptability criteria, whether it is possible to perform the test on those specimens, whether the specimens are available along with the requisition form, whether they are available along with their specific identity. So all the specimens must be checked when received in the laboratory for fitness of testing. This check should include appropriate container, like appropriate preservative or anticoagulant, which is required or which is mandated, should be used. Quantity, volume, which is required. You require certain minimum quantity to examine some specimens. So those minimum quantities should be available, volume should be available in case of blood or urine samples. Appropriate temperature conditions should be checked at the time of receiving. So if you are receiving a specimen, you should see whether it has been received or whether it has been transported in appropriate temperature conditions. Also, you should take the quality of the samples. In case of tissue samples, you should also check the quality of the samples, and you should also see if there are any leakages. Why you have to check for leakages? Because it may have deteriorated your analyte, or it may have caused any contamination. So you should also check for any type of leakages from your specimen. Record should be maintained for acceptance and rejections of all the samples received in the laboratory as per the predefined criteria. So you should have predefined criteria. It is not like your subjective. Today we are feeling that I will reject this sample and this sample is not correct or this volume is not correct. So Instead of that, you should have certain predefined criteria, and whenever samples are received in your laboratory, you should check those samples as per those predefined criteria, like what is the acceptable temperature, what is the acceptable timing of receiving, what is the acceptable volume, what are the different type of compromised specimens which should be rejected. So all those criteria should be predefined. You should have those criteria to be predefined so that it will remain a uniformity. Today some staff is on duty, tomorrow somebody else is on duty, day after tomorrow some third person is on duty. So they should know this criteria. So whenever, irrespective of the personnel who is sitting at the receiving counter, they will tally the samples with respect to this predefined criteria, and it will maintain a uniformity. If the laboratory rejects any sample, a communication should be made to the patient and doctor and need for recollection. So any time if you are rejecting any sample, you should specifically communicate to the relevant personnel. It may be a doctor, maybe a clinician, or maybe a patient himself. You should inform them that you are rejected a samples and what was the reason for rejection, and if there is a need for recollection or a resampling is required. So it must be appropriately communicated to the patient and doctor along with the need for recollection. Laboratory should exercise utmost care in the collection of the precious samples like histopathology, CSF, etc., whose recollection is either not possible or is difficult. So many a times we have seen there are certain samples which we call as a precious sample. Precious sample means where the recollection may not be possible or it is difficult. So CSF sample, once it is collected, you can collect it again, but it is a difficult. It includes an invasive procedure. So you should take appropriate precautions to considering the importance of those specimens and preciousness of those specimens when you are exercising your sample acceptance and rejection criteria. So you should view this information prior to the doctors or to the collection staff when they are collecting the sample. Histopathology samples, now it is many times you may not be able to get a repeat sample also or recollection. It is not possible to collect a specimen again and again because it includes a surgery. Sometimes even a major surgery is included, or some specimens are collected with a major surgery. So it may not be possible to have a resampling. So these samples will call as a precious specimen. So you should consider your sample acceptance rejection criteria. In case of precious samples, if such samples are available which are not fitting into sample acceptance criteria, then what are the alternatives are there? What should be exercised? Those all information should be available and should be given to even the treating doctors. Laboratory should maintain a record of specimens which were rejected prior to analysis. So if certain specimens are not fitting into your predefined criteria of sample acceptance, then you are going to reject them. So you should maintain a record. Whatever samples you have rejected prior to analysis, those samples must be, or those records of those samples must be appropriately maintained by the laboratory. Rejection details along with the reason for rejection should be maintained. So whenever you are rejecting a sample, you should also know the reason for rejections, or you should have appropriate documentation of reason for rejection of those specimens. Specimen rejection details can be used by the laboratory to identify the need and areas for personal training. So many times when you are rejecting samples, it gives your input like which area should be emphasized in the sample collection practices or in the phlebotomy area. Like many times we receive multiple hemolyzed samples. So that means a faulty collection technique has been used. So whenever you are receiving multiple or number of hemolyzed samples in your laboratory, that means the staff who are working in the phlebotomy areas, they are not properly trained. So it will give you an input that additional trainings are required in these areas. Similarly, here one example we have taken one more. If specimen contamination is detected, the container should be checked for sterility prior to the collection for the lot and batch. So if you are getting multiple contaminations or multiple during your microbiological examination, then you should check whether the containers are appropriately kept, whether they are appropriately stored, whether the standard collection practices are followed for sterile sample collection. Those precautions should be seen and should be taken, and if required, additional training should be imparted regarding this collection techniques. This information should be shared with the medical, nursing, and other personnel engaged in specimen collection and transportation. So when you are rejecting samples, you will come across certain repeated reasons. What are the reasons for sample collection? So those reasons should be informed to your medical staff, nursing staff, and personnel who are working in the phlebotomy area, so that when next time they are collecting any such type of samples, they will take appropriate precautions. They will follow the correct protocols. So, and due to which you can have a reduction in the sample rejections, or you will have less number of contaminations or less number of hemolyzed samples in your laboratory. So appropriate protocols should be followed and appropriate information must be communicated to the relevant staff who are involved in the sample collection practices. Now, what are the criteria for sample collection? Specimen suggestions criteria should always be upfront mentioned in the SOPs of the respective test. So again, these criteria should be predefined. Criteria should be there, like what are the specimens you are going to reject, if there are any unlabeled samples, if the samples which are not received in specific preservatives, or those samples which are received after a fixed timing or after certain excessive time lapse between the collection and transportation. So those criteria should be available in your SOPs as per the respective test. So these criteria may vary for different tests and from one area to another specialty area. So those criteria must be available in your SOPs or should be mentioned upfront in your SOPs. That is why we want it to be a predefined criteria. Terms of rejection of sample may include but not limited to following. So what can be the certain rejection criteria which can be defined by the laboratory? So here some list of some criteria we have mentioned as per the ICMR guidelines, but as you have seen, it mentioned that it is not limited. So you can have your specific criteria as per the requirement of the test, specific examinations, and specific samples. It includes unlabeled samples, broken or leakage tube or container, insufficient patient information, specimen label and patient name, UID on the test record does not match. So there is something different name on the sample, there is something different name on the request form, or the ID of the patient doesn't match with the request form, the ID of the patient doesn't match with the ID which is mentioned of the container or the specimen bottle. If it is does not matching, that can be also one of the rejection criteria. Hemolyzed sample, again depending on the test. If certain tests are sensitive to lysis, then those tests should be rejected. Some tests may not be sensitive to hemolysis up to some level. So considering those limitations and levels, you should see whether you hemolyzed samples you have to receive or you have to discard. Non-fasting sample, if certain tests require fasting sample and if the sample is not in the non-fasting state, that can be also one of your rejection criteria. Specimen collected in a wrong tube, wrong preservative, non-sterile container. So many times if you are having, now in most of the laboratories we have two urine containers. One is for urine routine analysis and one is a sterile container for culture. So if the sample or if the urine is collected in a non-sterile container, then again it can be one of your rejection criteria. If the tube is not correct, instead of serum tube you have used irritated tube, or instead of irritated tube you have used serum tube, a wrong preservative is used, certain coagulation studies needs to be performed in the sodium citrate tube. So if it is not collected it along with specific preservatives, then also samples can be rejected. Insufficient volume. So many times if you are coming across certain samples which require a minimum specific volume for those tests, and if the volume is not sufficient, then you may not be able to process the sample or you may not be able to examine those samples. So in that case also you can reject those specimens. Prolonged transportation time. Urine samples specifically for routine analysis the examination should be completed within 2 to 3 hours. But if the transportation time itself is 4 hours or 5 hours, there is no point in receiving those samples and there is no point in examining those samples. So you should be aware that the sample transportation time and the time lapse between the collection and the examination should be considered for certain specific test. What are the actions required for rejected samples? So once the sample is rejected, what will be the next course of action? Inform the authorized personnel. So who is the relevant or authorized person? As we have already seen, doctor or patient himself should be informed, or the phlebotomist should be informed. Request an another specimen if it is possible to get the another specimen, like I have mentioned, certain are precious specimens which may not be able to get another specimen. So request another specimen if it is relevant and if it is possible. Record the rejected specimen. You should keep the records of all the specimens which are rejected. Retain the rejected specimen based on preset criteria. Now it is not like that you have rejected the specimen means just you are going to discard it or just you are going to put in a dustbin. You can retain the specimen based on your preset criteria. So if certain specimens are to be rejected and retained, then you should define specific criteria which specimens you are going to retain even after rejection. So here a sample pro forma I have mentioned. Again, this is taken from ICMR 2021 guidelines. When you are rejecting a specimen, what information you have to collect? So serial number, UID of the specimen and the patient, type of specimen, what was the type of specimen, urine, blood, stool. Rejection, for reason for rejection, why you are rejected, maybe unlabeled sample, hemolyzed sample, insufficient sample, wrong preservative, excessive time lapse, delayed transportation, whatever is there, those reasons should be mentioned here. Remarks means like whether you are asked for a repeat sample, whether you have retained those samples, or whether the person is you are not able to contact the relevant personnel, relevant phlebotomist, or relevant doctor. If you are not able to contact them, all those remarks should be mentioned here. And finally, it should be signed and along with the name and designation of the personnel who is maintaining this record or who is recording this observation along with the date and time. So this was with respect to the pre-examination processes and sample acceptance rejections. So with this, we are able to finish this today's class on time. So if we have doubt, now we can take all those questions here. So we have certain questions. We'll see backup validation frequency for hematology and biochemistry. As I mentioned, validation and verifications, we are going to come to that. At present, we are in the pre-examination. Tomorrow or the next class may be on examination processes. So there we will see what about validation and verifications for hematology and biochemistry both. Can we collect sample in a lithium tube for biochemistry test? Certain samples can be collected. Certain samples can be collected in the lithium tube. So you have to see specific samples which are accepted in the lithium tube. Depending upon the type of specimen, you can collect certain specimens in the lithium tube if it is possible. One thing I will tell you, lithium tubes are quite costly. So it is better to get appropriate specimens in a tubes which are mentioned or which are recommended. Is patient consent required for routine clinical and biochemical investigation for clinical research project? Now, if you are doing a clinical research project, even if it is a routine clinical or biochemical investigation, consent is required because you are using the specimen for a research purpose. So a proper consent is required. Whereas in case of medical laboratories for routine analysis, if the patient directly comes to your OPD or directly comes to your laboratory receptions with a requisition form and pays the requisite amount of the bill, written consent is not required. But if you are using those specimens for any type of clinical research project as a part of good laboratory or good clinical practices, consent must be obtained. To be a GCLP trainer of the trainers, is there a special course period? You require those competent to train your other personals. Okay. Importance of consent in the form FNAC, bone marrow sampling, pap smear, and pap smear, bone marrow sampling, and pap smear, because these are invasive procedures.
पिस्ता कलर से तो पिस्ता कलर
Please, I am not expecting those who are. So, importance of consent form in FNAC, bone marrow sampling, pap smear, since these are the invasive procedures, you must obtain the written consent from this patient. because it is not a routine phlebotomy procedure. It may have certain type of complications of bleeding or bone marrow sampling during FNSP or bone marrow sampling. So a written consent must be obtained. Backup equipment, as I have mentioned, verification validation part, we are going to see it tomorrow in the examination processes. So there we will see your other doubts related to examination processes. How to report the test done in central line samples. So reporting, again, this is the post-examination part. We will see it, how to report the specific samples which are collected apart from your routine specimen. Predefined criteria for sample acceptance either in the write in the test requisition form. For example, patient ID, volume, time of receiving sample, and write in the note for all samples. So criteria of sample acceptance you have to define. Specimen form or request form should be completed as per those criteria, and you can mention it one of the criteria of your sample acceptance or rejection. So see, if somebody is just forgetting to sign, you cannot reject those specimen just because somebody has not signed it appropriately or somebody has just missed the sign. So you have to be, many times you have to be judgmental, like which specimens we are going to reject. On account of various minor reasons, you should not reject those specimens, specifically if they are precious. For fluid testing, which tube is required? For fluid sample testing, basically what type of testing you are carrying out depends upon that what type of tube you should require. As far as possible, try to use sterile tubes without any preservatives for fluid testing. Can histopathology tissue be rejected because of the request form not having adequate data? I told already you should be judgmental. A major histopathology tissue, just on account of somebody has not signed the requisition form, you cannot reject it. Okay, see, it is very difficult to get those histopathological specimens again and again. It is not possible at all. If somebody has done some appendix surgery and some surgeon has sent those appendix for you for examination or for histopathological examination, and some technician in between just forget to mention the name or just forget to mention the signature, you cannot reject that appendix because now it is not possible to get another appendix from that person. So you have to be judgmental considering the criticality of the specimens. Within run, between run, as I have mentioned, this is a part of examination. We will see it next in the next class. Why you want to retain the rejected specimens? As I have mentioned, many a times it may not be possible for you to get the specimen again. So you need to retain those specimen, or if somebody wants to cross check why you have rejected those specimen, you cannot just discard it. There should be some what we call it, there should be some accountability what specimens you are rejecting. So you can retain those specimens for not for like 2 days, 3 days, or 1 week, 1 month, something like that. You should keep it for certain period of time, maybe for 6 hours, 8 hours, till you get the fresh samples, or many times it will not be possible to get a fresh sample. So maybe you have to perform the examination on the same hemolyzed sample or same incompromised sample. So you should retain those samples for any future prospectus. Sample number and UHID with one more important. Yes. Routine clinical biochemistry test, take red tube or lithium heparin tube. Routine clinical biochemistry test you can perform in red tube also, lithium heparin tube also. So again, I will emphasize, please see what are your manufacturer guidelines. If certain tests are to be performed in a plain serum sample, then you should have red tube. If certain tests are to be performed in lithium heparin tube, you should have, again I am telling, lithium heparin tubes are costly. So please consider the cost factor also. Rejected sample storage is required as per the laboratory guidelines. Yes, it is required. You can keep it. I am not telling that you should keep it, or even the guideline doesn't mention that you should keep it for an extended period. You should see the relevance, and as per that, you can keep it. Do we need a signed consent form if a trainee is to collect blood for training purpose? If you are collecting the samples as a part of training, please take a in different consent form or say independent consent form, because if there is a samples is not collected as per the protocol, then you may have to take the resampling. And any extra samples you are collecting from the patient, you should have a patient has come to your laboratory with certain requisition, and for which maybe one tube is required. Now, instead of one tube, just for training purpose, you are going to collect one more tube, one more additional tube, then yes, you will require a consent. Signed consent form will be required. Okay, you have to consider those ethics criteria. Predefined criteria we have to mention on TRF. No, you cannot mention all those criteria on TRF. So in the first itself, we have mentioned that you should have standard operating procedure and it should be available to all of them who are involved in the sample collection activities. So that when they are collecting the samples, they will properly follow those protocols. For prothrombin time test, does citrate tube made of glass or plastic make a difference? It may not make much difference. Okay, but you have to see the transportation conditions also, because the glass tube may not be, you may not be able to transport it for long. TRF not signed histopath, then we can cross check with surgeon consultant before analyzing. Obviously. Anything apart from this? Any other questions? So most of the questions we have tried to cover.
Sir, there are few from other platforms also. If time permits, I can just tell.
We have time. We are well away that time. No
Mr.
problem.
Shankar Shetty and Mr. Mubu are asking, home collection samples are usually transport through two-wheelers, road and not good. So sample can be, there is a possibility of hemolysis. What is the solution?
So you should have appropriate packaging materials when you are transporting by two-wheelers or any type of public transport. So there are specific guidelines for sample transportation and sample packaging, so that the sample should not get hemolyzed, sample should not get spilled, or sample should not get contaminated. So those triple layer packing, if you are aware of those triple layer packing containers, you should use those triple layer packing containers along with the absorbent material, along with your primary container, secondary container, and tertiary containers. If you take all those precautions, see, if you are taking, then irrespective of the mode of transportation, your sample may not get or will not get deteriorated. But for that purpose, you should have to follow those sample packaging instructions, and those requirements you have to follow appropriately. You will not get any sample hemolysis. You can transport it by two-wheeler or any type of public transport also, provided that you are following the instructions and the protocols for appropriate sample packaging and transportation.
Hello, sir. Good evening.
Yes.
Yeah, sir. Pankaj this side. I have a couple of questions, sir. Sir, when we apply the internal QC and the results comes either minus 1 HD or plus 1 HD, its difference is around 10% from mean. So our results will go the same side, either plus or minus.
See, as I mentioned, the examination part we are going to cover on the in the next class. Okay. So as you are mentioning IQC, so it comes under examination processes. So we will cover it on in the next class. Okay. So,
Okay, sir.
I don't want to dilute the topic today, because at present, if we are focusing on pre-examination, we will completely dedicate this session to pre-examination itself. The next session will on examination. There we will take all those queries related to IQCs, validations, verifications. We will take all those in the next class.
Okay. So, sir, there is some order of tube or collecting for collecting sample.
Yes, when you are collecting the specimens with the closed system of collection, there is a specific order you have to follow. The order starts with blood culture. First is a anaerobic blood culture, then it is an aerobic blood culture, then there should be a citrate tube, then there should be a plain tube, then there should be your heparin tube, then there should be EDTA tube, and finally your fluoride tube. So there is a specific order of now, we have to follow that.
Oh, okay, sir. Okay, sir. Thank you so much.
There are some new questions in the chat box. I'll just read it.
I will check it. What is there? Two identifier and UHID important. As I mentioned, two identifier are important. Not only important, it is a requirement. Okay, and not only for any GCLP, it is for the patient safety, and it is as per the international patient safety goals. Two identifier are must. One with the identity and one with the name or any other thing. So two identifiers are mandatory. Okay. In ABG, arterial electrolytes and venous electrolytes values are different in some of the cases. How to reduce? As I mentioned, again, these are the obviously, because arterial blood has a different composition, venous blood has a different composition. So the levels of oxygen, levels of electrolytes will be slightly different from your venous blood. So there will be slightly different. So your reference range should be defined as per the arterial iron as well as the venous blood. In ABG, is recommended volume is not possible for neonate. It's okay. See, if you are collecting the specimens with routine syringes, you will never be able to get the sufficient volume in case of neonates. So you should see what are the other type of collection devices. So there are microtubes, there are other tubes which works on the principles of microfluidics, which you can use for ABG analysis and sample collection in case of neonates, preterm babies, very small 1 kg, 2 kg, 500 gram babies also you can collect samples with the help of those devices. It may not be absolutely possible to use your routine ABG syringes to collect the specimens. You may not get 2 ml, 3 ml of blood from the neonate or preterm babies. So you have to use alternative collection devices for the preterm and neonatal babies.
Sir, one of our international guests on YouTube is asking, we often get small baby specimen pediatric samples that are too small, that are too less for analysis, and we cannot demand for a fresh sample. So how do we do with this?
So as I mentioned, again, it becomes your precious sample. So if it is not possible to get a new sample, if it is not possible to get a fresh sample, anyways, you don't have alternative. You have to process that sample, but when you are releasing the report, you have to mention in your report that what type of difficulties you have encountered, whether it was the insufficient sample, then to make the volume, you might have diluted it, or you might have used some separate techniques, or you might have used some separate test method itself to process those samples. Or if the sample is hemolyzed, please mention in your comment that the sample was hemolyzed, or if the sample was insufficient without preservatives. Even if you are processing those type of samples, whatever difficulties you have come across while processing those samples, you have to include it in your final report. See, many times you don't have any alternatives, but these are all exceptional cases, not like that some routine patient, healthy patient has come and now you are afraid of asking for a repeat sample and then you are processing the sample with test with the same specimen. So it is not acceptable in that case. But like I have mentioned, for babies, for some type of patients, these are all precious samples. Cancer patient, it may not be able to get repeat sample many a times. So in that case, whatever difficulties you have come across in the sample acceptance criteria, whatever your criteria, you have to include it in your final report.
Sir, Dr. Manish is asking, can you repeat order of draw for closed system again as it is required for open collection also? So
now, open system may not require the appropriate order of draw, or there are certain different order of draw for open system. For closed system, as we have mentioned, it is preferable to use always the closed system. I can repeat the order. First, you have to start with anaerobic culture, then you have to go for aerobic culture, then you should have collection for your coagulation studies sample like citrate tube, then you should collect a plain sample, then you should collect your heparin tube, then you should collect your EDTA tube, and finally you can have your fluoride tube, and at the end maybe if you are using some special tube for ESR, that tube can be collected at the end. So this is a specific order of draw for closed system of sample collection.
sir, we have 4 more questions in the Q&A box. Would you like to take it now or maybe tomorrow we can?
Let me check. For lipid profile, 12-hour fasting is required. For fasting, 8-hour fasting, if not collected at once, what to do? See, 12-hour fasting and 8 hours, these are all not that specific criteria. And lipid profile, now many a times we do not follow even the fasting criteria, because if you see the regulations and guidelines from lipid associations and heart association, they doesn't make it mandatory to have the fasting samples for lipid profile. Okay, so even if you collect a 8-hour sample, at the same time you can collect the specimen for the glucose also as well as lipid also. Outsourced test, they ask resample for confirmation of the test value. We write in your outsource register, in your rejection sample, you can write down. Not necessarily you should mention it at different place. In the same place, you can mention that there is a requirement of the new sample or repeat sample. Yes, as I have mentioned, if you are analyzing any hemolyzed sample, if it is not possible to get a repeat sample or a fresh sample, you can always mention your comment in the report whenever you are releasing the results. So I think we are done with all the questions for today.
Yes, sir. Yes, sir. Thank you so much, sir.
Yes,
Shama, there?
almost done. Yeah. So, thank you for your insightfulness, Dr. Jayesh, and sharing your expertise and practical knowledge with our IVD community. Dr. Jayesh Varadi's dedication to empowering the IVD community with best practices is evident in this comprehensive approach to clinical laboratory excellence. Thank you so much, sir. So tomorrow again the same time at 7 p.m.
I think tomorrow we have a break. On account of Sunday, we have mentioned a gap in the
So
schedule.
okay. So Monday we meet again,
On Monday.
and we look forward to an insightful session again, filled with valuable takeaways. So we meet on Monday, 7 p.m. sharp. Thank you, sir, and thank you, our IVD community. Thank you, Nikhil, Namrata.
Thank you. Thank you all.
Thank you, everybody. Thank you.
Thank you, everyone.
We have a FAQ document in the chat box. If anybody has any doubts, please do refer to that. All the general ask questions for your certificates and the transcript and regarding the links, everything is available. So if any other questions, please let me know. And we have just requested for some feedback. If you have any feedbacks about the session and about us, so please do answer the feedback link. Thank you so much for joining today. We'll see you back on Monday. Thank you so much, Dr. Jay, sir.
Thank you. Thank you.
Namrata, any unanswered questions or can I close the session? Some people are asking how do we join via Zoom or via website. So the both the sessions are available on the website also and also on the Zoom. Exactly same whatever you are seeing on Zoom is also available on the website. So primarily this the multiple options were made available because there was some limitation in the number of people that can come on Zoom. We had only 1,000 participants license. So that's why we have crossed that. So that's why multiple channels the session was made available. Yes, the certificate is applicable for both every like whoever is attending. Thank you so much. Yeah. Yeah, Dr.
Nikhil ji, can you please end the session?
Yes. Dr. Sana is asking when will the certificates be available? Madam, after the last session, after the 8th session, you will get an email also, and also on the same link what we shared in the FAQ document, you will get the certificate on the link also with just your registered email ID. You can just enter and you can download the certificate. Thank you.